So this is the first study to look at concussion in relation to menstrual cycle patterns in young females. Previously, the only research has looked at traumatic brain injury and abnormal menstrual patterns. So this is the first study to look at this in sport-related concussion. The study included 129 young women ages 12 to 21, and 68 of those had a concussion and 61 had an orthopedic injury. We used orthopedic injury instead of a regular control group that was healthy because we know that injury and psychological stress, missing school, missing sport can adversely affect the menstrual cycle. The key findings were that for the concussed group, a quarter of them had abnormal menstrual patterns, 2 or more, during the 4 months of the study. In contrast, only 5% of those that had orthopedic injuries had abnormal menstrual patterns. That essentially translates into about a 6-fold increased risk for the concussed group to have an abnormal menstrual pattern. The real premise behind wanting to look at abnormal menstrual patterns in young women is that it can adversely affect everything from bone density to hormonal functioning in other areas as well. And so it's a really critical health barometer that we need to keep an eye on. Well, this is a preliminary study. It's a really good first step, but we need to do larger scale studies looking at more women across different backgrounds, and we also need to really look at whether or not there's a dose response for more injuries equal more abnormal disruptions, or if a more severe injury may have more significant consequences.